Welcome back to FRONTROW. The conversation tonight focusing on children and COVID-19. Has enough been done to protect children in the wake of COVID-19? We're speaking to Gladys Mugambi, who is the head of Department of Health Promotion at the Ministry of Health. Also with us tonight, Dr. George Owino, who is a research lead at Africa Early Childhood Network. And last but not least, Peter Mombasa, Assistant Director of the Children's Services State Department of Social Protection. Ladies and gentlemen, many thanks for staying on with us. Mr. Mombasa, let me come to you with the concerns that have been raised from this study, mostly talking about the quality of care at child care services in society. What social protection policies at this time speak about child care facilities? Are they regulated? How are they regulated, and by whom are they regulated?
Thank you so much, Michelle. And I want once again to come back to the Act itself. And we need to be very categorical that the Children Act has laid down rules and regulations towards registration of charitable children's institutions. And the rules are fairly simple, only that people don't want to follow them. And just a quick snapshot of how it goes. I mean, you just apply to the sub-county children officer. The sub-county children officer will then convene what we call an area advisory council for discussion and deliberation of your home, and then from there it's forwarded to the National Council for Children's Services for registration. However, most of our friends from the child care facilities see that as a very big hindrance, because there is so many things that come in between, because you must have a social worker, you must have a clinician, you must have a good environment for children to play, you must have all parameters that are set within the regulations of the charitable children's institutions. That makes them a little bit fear, so that they move out from the real regulations and start what we call the child care facilities, or by and large, the daycare centers. How do these daycare centers run? Two things. Number one, they can, in one way, they can go under the church, whereby whoever the bishop, whoever the pastor will start a church and then start a daycare center within the church, so people will leave their children there and go in the morning, then in the evening they come back. The second aspect that, which is more common, especially in informal settlements, is the daycare centers that are registered under the Social Development Fraternity of the State Department of Social Development, whereby a prospective person will go to the office of the SDO, and then they will say they want to start a self-help group, or of course some kind of organization. In that, they will convert that to basically do what we call a child care facility. So by and large, they are not basically regulated per se. Mm-hmm. They exist in some kind of vacuum. They use other documents to exist within where they are. And no wonder the county government, as of now, is doing some regulations so that they can still put some discipline in the daycare centers, so that most of the daycare centers can, of course, change. And I think with time, this thing will change. Mm-hmm. Thank you.
All right. Let's bring in Gladys. I mean, even as we speak about daycare facilities, other gaps mentioned by this study by Africa Child Network include children in informal settlements and those growing up in prison settings as well. What measures have been put in place, especially by the Ministry of Health, to make these spaces safer, enabling and enabling holistic development of the children in these environments?
Thank you once again. As I mentioned earlier, the Ministry of Health has the act which promotes the setup of daycare centers, or centers where babies can be breastfed and taken care of. And that has been embraced by the private sector very much. And it requires that the formal sectors, both formal and informal, are actually supposed to embrace this. But the problem is that setting up these centers requires that the people taking care of the children are well educated and the parents know exactly what they are supposed to do so that when they take their children there, the children are well taken care of.
Mm-hmm.
So when we talk about prisons, as it was said, the prisons are also areas that children are taken care of. When one is taken to prison, a mother is taken to prison and either she gives birth there, the child is supposed to be well taken care of, protected, and therefore breastfeeding must continue.
Mm-hmm. And
the feeding of the child after 6 months should continue to be appropriate, and the child should not be given food that is just being given to prisoners. These children should still get food that is well balanced with the vegetables, fruits. The milk should be available, the meat, so that they have a variety of foods and they can grow well because they are not actually prisoners.
All right.
So if both prisoners...
We're talking a lot about what should happen. These children should be treated like this, they should get this kind of nutrition. But the important question here is it happening as we speak?
We need to do more assessments, and that is what we are planning to continue doing. Since the Act was put in place, we've had to mobilize, come up with regulations, so that we can now roll out to the private sector and even to the public sector. So I can say it's happening partially, but we need to do more. And it's something that the ministry is very keen about. And we want to ensure that all sectors are taking up this so that we can take care of our children and we can show that we are committed.
All right, let's bring in George Owino now. George, from this research by African Child Network, a multi-country research, what are the glaring gaps in policies, especially those dealing with children under the age of 4?
Thank you very much, Michelle. What we found out is that even in the existing policies for childcare under the auspices of the Ministry of Labour, Department of Children's Services, the Children's Act, and other policy frameworks, provisions for the youngest of children, 0 to 3, is not really well articulated in those policy frameworks. This therefore means that services that these children need are not being provided because there's no provision for basic minimum standards to provide care for them. And this is the most important stage for human development. Actually, it lays the foundation for success in the future, whether it is in learning or whether it is productivity in the labor force, whether it is social interaction skills, preparing children for the future, resilience. This is lacking in a lot of policies. What also is lacking are guidelines. As just my colleague, Mr. Mombasa said, there are no regulations for regulating daycare, informal daycare centers. But you've said that these are realities that is going to live with us for the future. So what needs to be in place is how do we support these mothers who are coming out to fill in a gap that we already have in terms of guidelines for childcare services, daycare services. Then in the prisons, the Prisons Act provides that a mother can be accompanied by her young child to prison as long as that child is below 4 years. Should they give birth in prison, when the child gets to 4, then they have to leave the facility if the mother's sentence is still ongoing. The Prisons Act provides for children to be there, but doesn't provide how services will be given to these children. You know, the prisons officers need guidance. For example, nutrition, adequate nutrition, breastfeeding. Of course, but I can say our findings show that in the prisons, mothers who have young children are given a year to be out of work. They don't work. They can take time to just nurture their children, breastfeed them, interact with them, and lay a foundation for them. But you see, this is in prison. It's a restricted place. Children miss that kind of spontaneity to just play, free play, run around because of the restriction. So if we could have guidelines to provide for provision of childcare services in prisons, but also to regulate daycare centers, that would go a very long way. Again, in terms of policy, we are lacking a multi-sectoral coordination mechanism. all these policies and services are being provided in a sectoral manner. Health is doing their stuff, children's services is doing their stuff, education is doing their stuff, but we need a very strong and robust coordination mechanism to synergize the efforts of all these actors, both non-governmental and governmental, but also bring in families, bring in the county government. As my colleague, Mr. Mombasa, said, county governments have the mandate, the constitutional mandate to provide services for early childhood. However, they don't also have the policies. I only know of Mombasa that have a Child Care Act and the Nairobi City County. Others are still working on this. So if we can have all this in place, then I believe we can be able to provide services for children.
All right, and we'll be speaking about that a bit more, especially the multi-sectoral coordination mechanism. But Mr. Mombasa, let's speak about the social protection interventions that have already been put in place and implemented by the government that have gone towards cushioning children, especially those in early development, from the impact of COVID-19. Cash outs, for example, trying to keep them in school, for example. Some have lost parents, some whose parents are still ill. What interventions can we speak of?
Thank you so much, Michelle. And from the onset, I want to say that the best place for a child is at home. That should be the candid principle under which we need to discuss all these things. And of course, during the COVID period, quite a number of things happened, and we didn't realize that, of course, it will reach a time when the father will be in the house for the whole day and, of course, never move out. We didn't realize that certain things will come up. But then what has the government done towards making sure that the child is safe at home? I'll talk to this in two aspects. Number one, I'll talk to the aspect of children who are first outside home and now they are brought back home. Maybe they were in school or they were in charitable children institutions and the rest. And of course, I'll briefly speak about the cash transfer that is commonly known as Inua Jamii. So the first aspect is about the children who are in school and of course who are in the charitable children's home. Mm-hmm. What did the government do? First, the Minister of Education suspended all learning, which was basically one of the mitigation measures for making sure that the spread is curtailed. The second aspect was about those children who are in statutory institutions and, of course, charitable children institutions who are already in boarding, but, of course, one statutory institution is not their wish. They are in contravention of the law. And, of course, the charitable children institutions are those that are living there because maybe there's some poverty at home or something like that. So for those categories, the government did issue a circular whereby they were requested that all of them that were basically in those homes should be reunited with their relatives. So, remember, the best place for the child is at home. So somehow, if there were no immediate relatives, the extended relatives were supposed to be there. But then that was not the end. The government did do a follow-up, and with the support of partners like UNICEF, they did what we call following them back to home and seeing how they are living, and they could improve their standards by small tokens here and there so that they can be stable. And I think those are the basic aspects that were done under those children that are basically in school. Going back to the cash transfer program, basically this is, I'll talk about the OVC cash transfer program, whereby this is purely a monthly stipend to those orphan and vulnerable children who are living within us. As you are aware, the government basically gives about 2,000 shillings per month, and it's paid by monthly. And of course, the last payment ended about 2 weeks ago. And these are some of the interventions that the government was doing during the COVID. Having said that, there are other smaller interventions that were done, of course, under the civil society. So some of them were basically coordinated, others were from different angles, and basically that is what the government was doing at that time. Thank you.
All right, and let's come into you, Gladys. I mean, one of the biggest gaps also coming out from this conversation has been the lack of that multi-sectoral mechanism, a coordination mechanism, because there seems to be different organizations and different charities working towards the same goal but not working together. Talk to us about efforts really to have a multi-sectoral approach, to have a coordination mechanism where a child in a marginalized area can receive help as soon as it is realized that there's trouble.
Yeah, thank you. When we talk about the multi-sectoral approach, this is something that is already in our food and nutrition policy when we focus on nutrition. And in health, generally, we are ensuring that we are bringing together all the actors so that we can have discussions around issues that we have to deal with in health. If I can zero in on nutrition, we have the Scaling Up Nutrition, a global movement that I coordinate, and we have various sectors involved. We have the Ministry of Agriculture, Social Protection, we have education, we have the planning, and together we've come up with a common plan, which is the nutrition plan under the Division of Nutrition in the Ministry of Health. And we also have the civil society who have formed the alliance. We call it Civil Society Alliance for Scaling Up Nutrition. We have the business network also that has brought together various people who are in business and that is related to nutrition. And we are together working with the UN and various donors to ensure that we have resources going to the various activities that have been put in the plan. So that is the efforts we are putting in and ensuring that all sectors have plans that include nutrition, and the various policies that are being developed, the nutrition component is included. So what is required now is implementation, and the challenges that are there from national to county is human resource and adequate financing to the various activities that have been put in place, that have been planned for. And then the coordination needs to take place through meetings, which have to be regular. And we are trying to see that that happens as it is in the policy. That is coordination being done at an office that is central, like Office of the President, so that all sectors come together and discuss matters to do with nutrition. Mm-hmm. And there's also support to the Kenya Bureau of Statistics to ensure that they bring the information together through a project we call National Information Platform for Nutrition, which is NIPIN. And we have been working around getting the gaps that are in our policies so that we can improve on that and then ensure that it goes down to the counties. But again, I want to say that a lot has been done through even that partnership with the various sectors, and counties have now developed plans of action for nutrition, and what we need is to put in resources, that is human and financial, and ensure that the systems are enabling for implementation to take place.
All right, and perhaps, George, we can come to you in terms of, there seems to be need for more resources, especially devolved resources, to be channeled towards early childhood development from this study. What comparisons can we draw from countries like Ethiopia, for example, on the gaps, or how the solutions we can use to fill the gaps in early childhood development?
Thank you very much, Michelle. Once again, I want to say that Africa Early Childhood Network, for which I work, is a regional organization that brings together national networks for a number of countries in Africa, currently working with 18 countries, but we also coordinate the ECD cluster of the African Union. And therefore, we are sitting at a place where we can be able to look at all countries and create platforms where countries can learn from one another, Kenya can learn from other countries. And the intention of doing this multi-country study in Kenya and Ethiopia was really highlight what's going on in the informal settlements, in prisons, as regarding the 0 to 3-year-old children, the most neglected group. Although a lot is being done for children, the 0 to 3 is still a hidden group, and we want to bring this to the fore. I just want to bring a case study from Tanzania, where we worked together with the Tanzanian team, the government, the stakeholders from the civil society to develop a national ECD multi-sectoral plan, which brought all the sectors involved with ECD. There was nutrition there was education, there was health, there was social protection, there was the Office of the President, and all this was being coordinated by the ministry, by the Office of the Prime Minister. And we worked, and at the end of it all, they had a document that brought in the plans of each and every sector with a very strong coordination mechanism within the Office of the Prime Minister. That's a case study that perhaps we would like replicated across the continent, and we are bringing different national actors together, influencing even governments, ministers of education, ministers of health, to be able to ensure that this multi-sectoral coordination mechanism is happening across the continent. Because the provision of child care services is holistic. You cannot say that a child is being provided for health this side, education this side. The child needs all these services at one place. So the more integrated this can take place, the better it can be for us. So that's what I can say, that learning from Tanzania is a lesson that we can learn from. And just to maybe bring one learning that we got from Ethiopia, breastfeeding, exclusive breastfeeding is supposed to take place for 6 months. Yet the policy, the act in Kenya, the law provides that maternal leave is 3 months. So it leaves a gap of another 3 months. We found out that in Ethiopia, actually, maternal leave is 6 months. So things like working towards harmonizing, this kind of things across the continent, why not learn from Ethiopia, which has a very robust, act providing for exclusive breastfeeding.
Mm-hmm.
Yeah.
Mr. Ambassador, let's come to you. From a social protection lens, the childcare workforce seems to be rather lean, marred with the questions of quality as well. So when we talk about a multi-sectoral approach and multi-sectoral coordination, what are some of the solutions that we need to factor in when it comes to early childhood development?
Thank you so much, Michelle. That's a little bit a tricky question, but I'll take my time to respond to it. What are the measures that we need to take in terms of making sure that the children are safe at wherever they are? The truth of the matter is that we need to have a social workforce that is basically lenient and, of course, able to address the issues of the child. The challenge you're saying that the workforce is lean might not be the case, because we have got so many social workers who, by and large, are either employed and some of them are looking for a job, and there's need for them to basically align their skills towards childcare centers, and of course providing for basic needs that are required for the child. And having said that, the government, in one way or another, has basically equipped most of us to be able to offer the services. And of course, we are a service industry. Anytime we are called to give this particular service, we are available 24/7. Thank you.
All right, this is FRONTROW. We'll take a short break now, but we'll be coming back with this conversation. Are children the forgotten lot in the fight against COVID-19? Do speak to us. The number is 2215. You can also tweet us at KTN News Kenya or at Michelle Ngele. The conversation continues after this short break.